The H1N1 virus is here, but health officials say this is no reason to ban any mass crowd events. And although it is good news for carnival lovers who are gearing up for the season of revelry, the H1N1 surveillance team says it is not the time for people to let their guard down. Senior Medical Officer Dr. Merlin Frederick says the surveillance team has plans in place to deal with the carnival.
And we do understand the concern with mass crowd events, but we haven't reached the state right now at the point where we'll be closing down schools and preventing persons from gathering and the like. We haven't reached that stage as yet, okay? But at the same time, we have been in contact with the organizing committee of the CDF, Mr. Samuel and other members, and we have a plan in place for Carnival in much the same way that we did for jazz, for the Jazz Festival, and a similar thing for the cricket coming up as well.
With an increase in travel expected for the carnival season, the senior medical officer says there are precautions travelers can take to mitigate the spread of the virus. Dr. Frederick says the port surveillance system is in place, but travelers need to take responsibility and visit the doctor if they have flu-like symptoms.
This is the holiday season, summer, probably many persons have plans for travel. So we're telling those persons, especially if you're going to, countries with a high number of cases, to be especially vigilant. And if you come back home and you realize you're having signs and symptoms, don't just stay at home, go and get it checked out. You can go to the public facility, private facility. Anyway, we can do the test. As we said, the test is free. The rapid test is free, so you should go to your doctor, request the test, and it can be done at Victoria Hospital, and we can manage from there.
The team intends to step up its efforts to mitigate the spread of the virus. Director of Health Promotion, Cyprian Yard, says the public should pay attention to notices and stay tuned to any announcements from the surveillance team.
The situation for us in St. Lucia is not new, but what it means is that we are at the stage where we would have to step up efforts to contain the virus or the spread of the virus, and of course to observe the precautionary measures that needs to be taken and to unfold the plans that we have put forward thus far.
Dr. Frederick says the H1N1 surveillance for Carnival will be similar to St. Lucia Jazz protocol. Surveillance was beefed up during St. Lucia Jazz. The response started at the ports of entry and continued to the main jazz events. The goal then was to keep the virus away from St. Lucia. The focus now has shifted to controlling the spread of the virus. Alison Kentish, HDS News, Channel 4.